Hello friends, this is our next session on ORTC and we are going to discuss several things about repertory. So let's see. This is our third year, so up till now we have discussed lot of things and we try to improvise lot of issues related to art of repertorization. So in this art we have done a lot of different techniques like factual repertorization, conceptual repertorization, sectorial repertorization. So in earlier years we have different videos and lot of case exercises to learn these different methodologies. Even we also learn how to use two different charts of repertorial charts to confirm the medicine or to know the better choice of remedy. Even we also learn like how to use two different repertories. Like first we begin with larger repertory, and then if the case has lot of peculiar modalities and common symptoms, then we confirm it by Patak repertory. So first we use larger repertory, then confirm with smaller repertory. So number of medicines which covers all the rubrics get reduced, and we have a short list of remedies. Even first we initiate with complete repertory or synthesis and then confirm with the canned repertory. That way also we can differentiate, use different repertories in same case. So this we already learned. Even we sharpen our repertory skill with the help of rubric exercises, case exercises. So this is a full map of our clinical training. But this time my focus is on selection of remedy, because when I go through thousands of your solved case exercises, I realized that most of our participants has main difficulties is selection of remedy. It's not a problem to select the rubrics. They are able to convert the rubric in cases and even rubric exercises also. So up to this level we evolve, but next step we need to develop ourselves. We need to understand several things and not only for students or beginners, it's also for experienced homeopath. They also have a lot of difficulties to find the medicine. So here I give you one small example of one case where a patient has a cramping kind of lot of abdominal pain, especially in umbilical region, especially at night. And when inquired, he says like, when I have a pain, I start TV or play a game on mobile, and I divert my mind and I forget my pain, or maybe this is the way I can tolerate my pain. So I have selected these rubrics: mind, occupation, amelioration, abdomen pain, cramping at night, abdomen pain, cramping, umbilicus region of, and these are the list of 10 or 12 remedies. Now question is how to select one medicine from it. It's impossible, because repertory is just a mechanical tool. It gives you direction, it gives you a list of the remedies, but a physician has to decide the medicine. Now what are the factors affecting when we are going to select the remedy? That we have to learn. Something is going in background. Like suppose in this case, if the person, I understand the patient as a whole in general, then I can say like this is Kalathia, or this is China, or this is Ignatia, or this is Mesothelium, right? So that is necessary. And even lot of things we have during the conversation which we are not able to put in the repertorial language. Those things going to help us to decide the medicine. Am I right? So this is, I say, you have to understand the patient as a general. You have to know the person, the personality, the character, and lot of other things. You have to understand that everything that's going to help you to select the medicine. So this understanding of the patient play as a background role. It's not directly going to help you to select the medicine. But when you have a list, then you think, yeah, this is correct. A patient has this night and all the symptoms we added, then we realize person is dependent, talk about the money, security, all. So it might be a Kalathia, and you say first is Kalathia. Or person has like his father passed away a few days back, so it might be Ignatia. So this is the way that background understanding is going to help us. And that background understanding is nothing but knowledge of materia medica. So here the important role, very very important role of materia medica. So if you are very very good, excellent in repertory, then also you are not able to practice it with good successful results. You also have understanding of materia medica. You also have knowledge of materia medica. And materia medica is just one word, but it's not something just a word. It has a many things. It's not a simple thing, just you read the remedy in materia medica or any book and you select the medicine. There are a lot of things you have to see in materia medica, and not only during the case, but I believe you have to refer the materia medica daily as like repertory, because these are the two poles, or two, you can say, the way, so you cannot separate them. So here the role of materia medica has following things we have to consider: a knowledge of remedies, keynotes, peculiars, genius. It's a generalized pathological expression. Like person comes with us who has a burning in throat, burning in eyes, and hands and palms are also burning. So we take the burning as a genius of that patient, and we want that intense burning as a genius in remedy. Now if you take this all the rubrics, then it's no problem if you have a confidence over that rubric, but this burning is 90% of cases help us as a background of the analysis. Like we have in the chart we have few remedies, and we have to find which remedy has intense burning. Are you getting it? Now core symptoms, there are core symptoms are also there in each remedy. Then remedy has personality, many remedies has their own personality. Each thing we are going to understand separately, so don't worry. General characteristics, affinities, sphere of action, mechanism, and conceptual understanding. For example, themes of kingdom, themes of animal kingdom, and various other concepts are also there, especially in Vijayakar method, Sehgal method, Vitulkas method. There are other methodologies. So this everything has their own place. Now first we try to understand the knowledge of remedy. So you have to know the remedy at least. You have to know the materia medica, at least the you have to know the MATERIA MEDICA of minimum 50 remedies to have a good practice. Without knowledge of medicine, it's very difficult to practice homeopathy. Not even I say homeopathy in Ayurveda, allopathy, anything. You have to know the medicines. If you don't know the effect and side effect of paracetamol, then how would you prescribe it? Right? The same way you have to learn the sulfur, pulsatilla, lycopodium. Then only you are able to prescribe them. It's not just repertory is not like a magical stick. It's just you are moving and in your hand the medicine coming up. Lot of things, the background things are needed. And these are the background things. So you can use Allen's keynote, you can use Boric, you can use Phatak, Boger, Synoptic key, Vitulka's Viva, Rajan Sankaran's Soul of Remedy, anything you can use. Kant's MATERIA MEDICA. But at least you have to read the medicine from 1 or 2 books. And accepted book is Boric. Boric has uniquely written the remedies. So I accept Boric and Phatak as my reference books. But it's not any rule. You can choose any 1 or 2 MATERIA MEDICA where you go regularly and refer them when you are going to select the medicine. Now let's talk about the keynotes. Several peculiar symptoms, very specific, is there in each and every medicine. We call them keynotes. So here we have a belladonna from Phatak's MATERIA MEDICA, and here mucous membranes become dry. So just simple, mouth, eyes, nose or internal organs, they become dry. This is keynote of belladonna. This is we called keynote. So when you select the rubric dryness in general, you have more than 200 remedies. So it's not going to help you. But you know, like belladonna or brownia has lot of dryness. And when you have a chart and you have remedies, and when you keep this understanding as a support, a background understanding as a support, then you select the belladonna or either brownia, because the dryness is so prominent in that case. So this is the way you have to take support of that background understanding. And this background understanding is not coming in just one day. You need to read, you need to experience, you need to read MATERIA MEDICA, even you need experience also. And when you are experiencing in your case, then you have to face lot of failures. This is the reason we keep case exercises in this course. Because in case exercises, if you have selected pulsatilla instead of sepia, then it's no problem, because nobody is going to suffer because of this. And even your failure is not there, because this is you can say exercise, it's a training, right? So this is necessary, but this is very necessary. When you work more and more day by day, then you have developed that background. You have that background. Now we have another point, peculiars. Each medicine has a lot of peculiars, and even in cases also we look for the peculiars. So here we have a rustox from Phatak MATERIA MEDICA. Symptoms appear on left side or go from left to right. So this is very peculiar, right? Each and every medicine do not have this characteristics. Only few medicines. So if your case has this kind of peculiar, you can directly select rustox. Now, as already we talk about genius. Genius is pathological general expression of the remedy, where a few expressions, few words pick the every detailed characteristic of that remedy. Here like we have a belladonna from Pratak, burning heat. Burning heat. A person is feeling a heat in head, in mouth, in eyes, in nose, in vagina, or in abdomen, anywhere, but it characteristic of a burning in character. In body, during the fever, anywhere. Bright redness, all the orifices, throat, anything is very very brightly red. And dryness. So suppose you are looking for your case which has a bright redness with dryness, directly belladonna coming up. So this is we call genius. For example, in sulfur, you can say the burning, yellow discharges. This is sulfur. Heat aggravation, warmth of bed aggravation. So warmth aggravation. This is genius. Dryness of bryonia. So dryness in bryonia is genius. Restlessness in arsenic is genius. So this is the way each medicine has some one peculiar word or few words, not only one, few words which speak the entire characteristic of the remedy, entire pattern of the remedy. This is we call genius. And we cannot find directly this thing even in particular symptoms. It's not just a symptom. It's the general characteristic of that medicine. So that genius should be matched. Now core symptoms. Here we have a sulfur from boric. These are the underlying you can say sentences is called core symptoms, like sulfur is highly Hahnemann's antisoric. So when you have a soric expression, you can think of sulfur. Affinities for skin. We all know sulfur is very good skin remedy, right? Heat and burning, as like belladonna. Here also heat and burning. Itching, worse by heat of bed. Feebleness of tongue. Dry and hard hair and skin. 11 am aggravation. Red orifices, redness. Standing aggravation. So this is sulfur. So you do not have to read everything that is written in Materia Medica. These few core things going to decide the medicine. And you have to remember that. So you have to carry a exercise where you have to just select a 5 sentences about that remedy, and you have to remember. You have to make the exercise here for 15 medicine at least. More then more better. But 15, just 5 sentences of each medicine. Only 5, which is without that 5 sentences you cannot think about that medicine. You have to remember that. And this is going to help you. So some symptoms in eye chapter, in ears chapter, in nose chapter, this is not going to help, because you can refer them or you can look them in repertory. But some peculiar, some important expression you have to understand about each medicine, that you have to remember. And this is you have to need, as we are doing a rubric exercise and case exercise, you have to do the exercise of these things. Of each medicine, only 5 sentences, which is so core to that remedy. You have to write down them, you have to prepare the notes, and it is going to help you when you are going to select the medicine. Otherwise, sulfur has more than 2000 symptoms. So you have to know something very, very core of that remedy. Now, personality. This is very, very important thing. It's not something related to animal, plant, mineral as we see in kingdoms, or especially if you are talking about a sensation method. It's not like that mental symptoms or mental things. It's general type of personality, the general quality of that person as well as the medicine. That general qualities we call them personality. So here pulsatilla from boric, and the pulsatilla is female remedy. So here it's not like female, or pulsatilla is always used in female patients. Female means the personality is feminine in quality, a female like. So who has a lot of emotions, caring, nurturing, that kind of quality. All lady related issues, the emotions are more prominent than the intellect. Now mild, gentle, yielding, these are the general qualities. This is we call personality. Sad, crying readily, easily cry. Weeps when talking, even during the talk the person start to weep. Person is changeable. So these are few words which speak the personality of pulsatilla. Same way egoistic, I am better than others. A little philosophical, try to be better than others. Issue of insults, honor, this is we commonly see in sulfur. Same way the lycopodium who is looking for, who feel like I am a weak and small, so he is looking for power. So he need to be at powerful position. It's a lycopodium. So each medicine has a few characteristics related to personality. Suppose we had discussed that abdominal colic case, the person is dependent and talk about the security and protection and all, like after all we are just, this is a corona time, so what going to happen I don't know, so we always have to look for the money and all. The person, if the person is talking such a way, then you easily think like this is Kalathia, because person is talking about dependency, security, money, protection. This is common in Kalathia. General characteristics. So something that is written in any medicine, in boric or in Clark or in Fatak, a general description, that all general things is called general characteristics. So here cuprum metallicum, spasmodic affections. So all type of spasms are so prominent in cuprum metallicum. Spasm, convulsion, epileptic attacks, chorea. So this is there. So whatever written here is called general characteristic. Now we have to look for the affinities or sphere of action. So here the pointed things in Rush talks from Fatak, a skin. Simple thing, right? Skin. Rheumatism. Typhoid like fever. Nerves. Spinal cord. Glands. This is not something from you can say any special kind of materia medica. It's just from Fatak. And you say how many sphere of action and affinities written in bold capital. Right? This is very very important to understanding each and every medicine. If the medicine cover the affinity and sphere of action, then it works better. Second thing, suppose you have a list of remedies, many remedies like 5 or 10 coming up in repertory, and you have to choose one, then affinities help you to decide which I have to select. Suppose in our first case sepia, why we have selected sepia? Because sepia we know it is very good hormonal remedy and the case has hormonal issue. So this is the way. If the person has lot of hormonal issues, you can think about sepia, pulsatilla. That if the person has gastric issues, then you can think of Naxomica, Lycopodium, China. So this is the way. Now miasms. It's a very important chapter when you are going to select the medicine, because you do not have to select the medicine randomly. Though that group of remedies coming up in chart, we have to select the medicine the way the disturbance is there in that patient. If the disturbance is allergic, then you have to select the psoric remedy. If it is kind of lot of discharges and sluggishness and something related to exudation or growth or accumulation of something, then you can think of psychotic miasm like pulsatilla or any psychotic remedy, MEDICA. And if the complaint is destructive, or in the case the personality has some destruction, in fears have destructive fear like somebody is going to kill me, or dreams has like person just come and kill everybody in the house, that kind of dream, then you have to select the syphilitic remedy. But what happens, suppose your case has all the symptoms you put in the repertory and you select all the symptoms has psoric expression and you select the syphilitic remedy, it won't work. If you wrongly select a similar medicine instead of a similimum, the exact one, but if your miasm is correct, then medicine is surely going to affect your case. It up to certain level it produces positive effect. Suppose your case has indication of calcaria and you select sulfur, then it's going to work because both are psoric remedy according to Hahnemann. Or either instead of calcaria you select the Lycopodium, then also it works because it's psoric remedy. Or if case has all the psychotic expression and you select Thuja or Medorinum or Pulsatilla or something similar, psychotic remedy, then it also works. So this is the way. You put all the expression, but where, suppose let's go back. Here you see calcaria, China, Ignatia, Mesothelium, Podophyllum, Iodum. Suppose you have to select in this case Iodum. The symptoms, you cannot see in the symptoms a very prominent miasm. It's just cramping and occupation. So it's not that much, you can say the peculiar to understand like which miasm is prominent. So if the case has tubercular miasm or something leprosy kind of miasm, then you have to select the iodine. So that background understanding if you have, it's going to help you. Syphilitic miasm, then nitric acid. But if the case is psoric, then calcaria, rustox. This is the medicine going to help you. Now we have various concepts. Here the role of concepts are there. So even many homeopaths have good experience and good grip on various concepts. But I say, especially to newcomers, juniors, try to understand the basic first. Then apply a sensation method, or predictive method, or Calcutta method, Segal method, Vitulka's method. There are a lot of methodologies. I'm not say, or not even have to say to anybody like these methods are useless, because thousands of homeopaths has experienced a good results in their own cases when basics are not working in their cases. So these methods are not useless. Even I say you have to master the method because it's going to help you as a background. But in your case, if you exclusively doing something, one method, just you can say fixedly just stuck to the one method, then it's not going to help you in practice, because each and every case has their own different individual pattern. If that pattern is not going to match with that method, then it won't work. Suppose you want to work with Segal method and you have to take all the mental rubrics, but you find and you forcefully try to collect few mental symptoms from that casual talk. But if you are open, then you can see like there are a lot of physical expressions are also there. And if you are exclusive to that method, then you avoid that very important thing and you miss the medicine. So you have to at least know the basic, how to work with basically with simplest way with cases. Then you can use these concepts in your practice. Like suppose you have selected a case and you feel like it's a purely mineral case, then you can select the calcarea, no problem, because that medicine coming up strong in the chart. So you have more confidence. So this method concepts are nothing but extended form of Materia Medica. It's one kind of tool, additional tool. Suppose you take support after the repertorization, you want to take a support of something, then take support of them, no problem. Right? So as a support you can use them and it really going to help in our cases. So this is we learn. This is my main message, like how to use a Materia Medica as a background understanding to decide the medicine. Now let's try to understand this thing with the example of one case. So this is a case of 29-year-old male patient who had complained of PUO, pyrexia unknown origin. So it's a fever case, but we can say it's a chronic fever because he is suffered from fever since many days. So he was treated with lot of antibiotics, antiviral, anti-malarial and also from antifungal. But since 1.5 months, so 1.5 months, 45 days, fever is never subside with any kind of treatment. Even he made all kind of laboratory tests and all kind of radiological and graphical scanning, but there is no reason was found. So it's unknown. This is the reason it called PU, unknown origin. So ask the first question, tell me every detail how your problem started, what exactly happened to you physically, mentally, emotionally at present. So he replied, before 1.5 months I had fever. Not so high, just 99 Fahrenheit or 100 Fahrenheit, but every day I feel little fever in my entire body. So daily he has fever, but not so high, it's low. Okay, when you have fever, what happened to you in your entire body? And he replied, nothing so big issue I have in my body, but fever is always there, and main problem is there is not any report is positive. So this is carrying, because what is, suppose you have a like what is happening in your body, then you don't have that much care. But suppose you are unable to identify what is going on, then it makes a more problem to patients. Even many times I see patient gives you symptoms Even many patients visited a lot of doctors, 2, 3, to find out like what is going to happen to me. So now I have tension that why I had fever. So this is you can say the common anxiety in patients when their problem is not diagnosed properly or unable to diagnose. Doctors give me one antibiotic and no change, then another antibiotic, no change, then another and another. They experimenting whatever available in market, but my fever is never reduced. I go to 4 or 5 different doctors, but nobody helps me, and every time they give me side effects, but my problem is as it is. So ask the question, what kind of changes you have in your body during fever? This is very important, not only in body, but you have to ask this question in acute cases especially, like what kind of changes you have since you have this acute issue, and that changes decide the medicine. So he replied, when everybody touch my body, they feel heat in my body, but sometimes I feel intense cold in my body. Coldness started from my left hand and then it goes up and spread up in my entire body. Now it's very peculiar, right? This is we are looking in our cases always. And when I say, when we heard these things, we become so happy as we love it. But mostly I feel coldness only on my left side. So it's confirmed like coldness sensation during the fever, especially on left side. And even he confirmed, I don't have rigors. Rigors means chill. Here it is not chill, it's just coldness. But I feel intense coldness in my body. I feel as if my bones are made up by ice cubes, so it's icy coldness, not simple, very cold. But it's not subjective. You cannot see from outside. Outside if you touch it, it heat, but inside you feel cold. Very peculiar, right? What happened to you? Ask the question. Why you have these bandages? Because I see he has lot of bandages in your hands and fingers. So ask the question. So anything peculiar you find out, you have to inquire about it. You need to be inquisitive. So he replies, since I have fever, I have very deep sleep. Deep sleep is another symptom. I don't have consciousness. So comatose kind of sleep. So I bite everybody in my body also. Here a spelling mistake. It's not beat, it's bite. First I bite my little 4-year-old son one night. And I bite my wife. So now they are not sleeping with me, but now I start to bite myself. So he is biting during the sleep. Others and himself also. Another very peculiar vipa. So yesterday I chewed my fingers very badly, very tight, and whole bed is spotted with blood. Then we go to doctor and he bandages my finger. This is never happening before in my life. So very peculiar, right? Since I have fever, I see lot of dreams. So sorry, ask the question. Now tell about your dreams. Because I want to explore one more area so we can find something else. And he replies, since I have fever, I see lot of dreams. It's totally unusual for me. Last night I see one dream in which one very big snake following me. Wherever I am going, he is coming behind me. Before 3 days I show one another dream in which I show one big lake and I am fishing there, but suddenly one crocodile emerges from water and I run away. So these are the dreams. Now what to do in this case? These are the peculiars. Fever without apparent cause, low grade fever. If you put this everything in repertory, then you don't find the remedy. Fear of snake, dreams of snake, fear of animal, fear of sudden attack, escaping, delusion, escaping, all whatever, fever low grade or heat or remittent fever, type of fever, all this, because this is the art of repertorization. You have to select something which is very, very peculiar, and then rest of the information you have to use to confirm it. Fever with rigors but intense, fever without rigors but with intense cold in body. Coldness in left side of the body. Coldness feel as if bones are made up of ice cubes. Since fever, have very deep sleep. Biting during sleep. Dreams of snake, dreams of crocodile, dreams of sudden attack, dreams of escaping from danger. So now, which are the peculiar things? Coldness, right? Especially in left side, internal coldness, deep sleep and biting. Now I have selected this repertory rubrics from the MAC repertory. So here coldness is in general, that's why I selected in generality. Coldness left side, coldness internal, coldness icy, and this biting symptoms I had added. Biting, fingers, sleep pain. Even you can add sleep deep or sleep comatose, sleep heavy, that kind. But here you see the LFs coming up so strong. Second is bromium, graphitis, ambrosia, carbobase, phosphorus, tuberculina. These are the remedies. Now what to do? We have to select one medicine. Either we can refer MATERIA MEDICA, or we can take the background understanding of the patient to decide the medicine, as we already discussed. So here I understand, I know, like this is the snake remedy qualities. Side affinities are very, very strong in snakes. Side affinities is so strong, peculiarly there in snake remedies, and here the peculiarly left side is a cold. Second thing, snakes is a reptile, and all reptiles are cold-blooded animals. That means they do not have thermal regulation in their physiology. So they have to regulate their body temperature externally, and this is many times we say like crocodiles are just sitting, or not crocodile, just that water tortoise are also sitting outside and just basking on the sun. Why they are doing? They are taking heat, making a body hot. So they are unable to handle they don't have that capacity to regulate the heat or cold in their body. And here what we have? Coldness. Coldness is not characteristic or something common in fever, right? Rigors is there, chill is there, but internal icy coldness is common. It's not common. That means the body is not able to regulate the thermal regulation of that patient. This is another characteristic of snake remedy. Another thing, fear, image or dreams of snakes and reptiles. Not only snakes but even reptiles. It's also one indication to think about snake remedy. And here we have two dreams, and both has reptile, snake following or crocodile symbols. So this is confirmation with the help of that kingdom ideas or sub-kingdom snake remedies, group themes. Like snakes has this quality, so we can easily select LFs. So I have prescribed LFs 1m. 1 dose of LFs 1m every day for 3 days, followed by wait and watch. I recovered completely within 1 week, no fever returned then after, and he is completely alright. So for 1.5 months he has suffered from that big element. Now it vanished within 1 week. So all the credit goes to homeopathy, right? So this is the learning. How that background understanding of snake and all going to help to decide the medicine is important. Learning here, it's a so simple case, but in each and every case that background understanding of materia medica or whatever you know, they're going to help you to decide the medicine. So this is our learning today. We try to understand up till now, we try to learn so many things in this course, and we try to do lot of things together, right? This is our main, it's kind of a fun for us, right? Now it's not just kind of you can say the boring things, or and even this is very very important, because suppose you read something or watch a video, you need to make a lot of effort. Suppose you watch a lot of videos how to learn driving a car, and then you try to drive a car, and then or you read a book on how to drive a car, and then you start to drive a car. It's not possible. This is the reason our entire team is putting a lot of effort to hold your hand and make your journey of this evolution, this development. Because without working on a real exercises, you don't know how to use those rubrics, how to use the repertory, how to search in the chapters, which thing available in which chapter. Even in many exercises, people are, because it has a mental expression, so people check in mind, but actually it is available in sleep or in other chapters. So this is very very important. Like suppose you are not able to find something in one chapter, then where you have to look? This is comes in your mind if you have worked enough. So I say it's a very unique course designed by our team, and we can learn a lot of things. This is the reason we have given it the course a name, a training. Not any course is, as per my knowledge, available in Repertory where these much of the participants involved, and each one has given a personal attention and have a collective journey. So it's a very big thing, and we are so happy about, like, we had done something, and we had because the community has given us so many things, so we have to give something back to them, and this is our honest simple effort. So let's have journey of same things after 1 year. Thank you so much.